If you mix up left-sided and right-sided heart failure on the NCLEX, you can miss a question that should actually be easy. The trick is not memorizing two long lists. You need to understand where the blood backs up. Once you understand that, the signs, symptoms, and nursing interventions start making sense. In this video, we are breaking down left-sided heart failure, right-sided heart failure, priority nursing interventions, and 3 NCLEX-style questions. Let's start with normal circulation. Normal circulation, the right side of the heart, receives deoxygenated blood returning from the body. The right ventricle pumps that blood toward the lungs. In the lungs, carbon dioxide leaves the blood and oxygen enters. The oxygenated blood then travels back to the left side of the heart. The left ventricle pumps that oxygen-rich blood out to the rest of the body. So remember this basic pathway: right heart to lungs to left heart to body. Now let's see what happens when one side of the heart cannot pump effectively. Left-sided heart failure. Left-sided heart failure occurs when the left ventricle cannot pump blood forward effectively. If blood cannot move forward properly, it starts backing up behind the left ventricle. Where does it back up? Toward the lungs. That gives you one of the easiest heart failure memory tricks. Left, SAS, lungs. As pressure increases in the pulmonary circulation, fluid can begin leaking into the lung tissue and eventually into the alveoli. Now think about what happens when the lungs become congested with fluid. The client may develop shortness of breath, dyspnea with activity, orthopnea, meaning difficulty breathing while lying flat, paroxysmal nocturnal dyspnea, where the client wakes suddenly at night feeling short of breath, crackles on lung auscultation, cough, decreased oxygen saturation, pulmonary edema, and in severe pulmonary edema, the client may produce pink frothy sputum. The client may also experience fatigue because the left ventricle is not pumping enough oxygenated blood to the tissues. Here is the NCLEX connection. If the question describes a client with crackles, dyspnea, orthopnea, pulmonary edema, or difficulty oxygenating, think about left-sided heart failure. Remember, left, lungs, right-sided heart failure. Now let's move to the right side. Right-sided heart failure occurs when the right ventricle cannot effectively pump blood forward toward the lungs. Once again, if the blood cannot move forward, it backs up. But this time, it backs up into the systemic venous circulation. In simple terms, it backs up into the body. That gives us our second memory trick. Right ease, rest of body. As venous pressure increases, fluid begins accumulating in tissues. The client may develop jugular venous distension, peripheral edema, swollen feet and ankles, dependent edema, rapid weight gain, ascites, which is fluid accumulation in the abdomen. The liver may also become enlarged because of systemic venous congestion. The client may experience fatigue and weakness as cardiac output decreases. So when you see swelling, think about the right side. If an NCLEX question describes jugular venous distension, peripheral edema, ascites, and rapid weight gain, right-sided heart failure should immediately come to mind. Remember, right rest of body. There is another important point. Right-sided heart failure can develop because of left-sided heart failure. When pressure remains elevated in the lungs for a long period of time, the right side of the heart has to work harder to pump against that pressure. Eventually, the right ventricle can begin to fail too. That means a client with advanced heart failure may show signs from both sides. Quick left versus right comparison. Let's put them side by side. In left-sided heart failure, blood backs up toward the lungs. The major problem is pulmonary congestion. Think crackles, dyspnea, orthopnea, pulmonary edema, low oxygen saturation. In right-sided heart failure, blood backs up into the systemic circulation. The major problem is fluid accumulation throughout the body. Think jugular venous distension, peripheral edema, dependent edema, ascites, rapid weight gain. So if the lungs are giving you the clue, think left. If swelling and systemic congestion are giving you the clue, think right. Nursing interventions. Now let's focus on the nursing interventions that commonly appear on the NCLEX. Respiratory assessment. Assess respiratory rate, breathing pattern, work of breathing, oxygen saturation, and lung sounds. This is especially important in left-sided heart failure because pulmonary congestion can worsen quickly. Listen for increasing crackles. Watch for increasing oxygen requirements. Pay attention to worsening shortness of breath. Positioning. If the client is short of breath, place them in semi-Fowler's or high Fowler's position. Raising the head of the bed helps improve lung expansion and can make breathing easier. A severely dyspneic client may also feel more comfortable sitting upright. Daily weights. Daily weights are extremely important in heart failure. Weight should ideally be measured at the same time each day, using the same scale and similar clothing. Why? Because weight changes can reveal fluid retention before some other signs become obvious. Strict intake and output. Monitor all fluid intake and urine output. This gives the nurse important information about the client's fluid balance and response to treatment. Assess for edema. Check the feet, ankles, legs, sacral area, and abdomen. Watch for increasing dependent edema and ascites. Monitor lung sounds. Increasing crackles may mean fluid is accumulating in the lungs. This can be an important clue that left-sided heart failure is worsening. Medications. Administer prescribed medications, including diuretics. Diuretics help remove excess fluid. When administering diuretics, monitor blood pressure, urine output, electrolytes, especially potassium, and renal function. Sodium and fluid management. Teach the client to follow sodium restriction if prescribed. Excess sodium promotes fluid retention. Some clients may also require fluid restriction depending on the severity of heart failure and the provider's orders. Energy conservation. Heart failure clients may fatigue easily. Cluster nursing care when appropriate. Allow rest periods. Encourage activity according to the client's tolerance and treatment plan. NCLEX fluid overload tip. Here is a very important NCLEX point. Heart failure questions often test whether you recognize worsening fluid overload. Watch for a pattern. Sudden weight gain, increasing edema, increasing crackles, worsening shortness of breath, difficulty lying flat, decreasing oxygen saturation. These findings can indicate that the client is retaining more fluid and their heart failure may be worsening. Daily weight is especially important because a client may accumulate significant fluid before the swelling becomes very obvious. So, if an NCLEX question gives you a client with heart failure who suddenly gains several pounds over a short period of time, do not dismiss it. Think fluid retention. Think possible worsening heart failure. Also remember that left-sided failure may eventually put enough pressure on the pulmonary circulation to strain the right side of the heart. So, advanced heart failure may present with both pulmonary symptoms and systemic edema. Do not assume the client can only have signs from one side. NCLEX question 1. A nurse is assessing a client with left-sided heart failure. Which findings should the nurse expect? A. Ascites. B. Jugular venous distension. C. Bilateral crackles. D. Peripheral edema. Choose your answer. The correct answer is C. Bilateral crackles. Why? Left-sided heart failure causes blood to back up into the pulmonary circulation. That causes pulmonary congestion and may produce crackles. Remember, left, lungs. NCLEX question 2. A client with heart failure has gained 2.2 kilograms, or approximately 5 pounds, in 3 days. What should the nurse do first? A. Encourage the client to increase fluid intake. B. Assess the client for signs of fluid volume overload. C. Document the finding as expected. D. Encourage the client to lie flat and rest. Choose your answer. The correct answer is B. Assess the client for signs of fluid volume overload. Rapid weight gain in a client with heart failure can indicate fluid retention. The nurse should assess for other findings, such as edema, worsening crackles, shortness of breath, and changes in oxygenation. NCLEX Question 3. Which finding is most consistent with right-sided heart failure? A. Orthopnea. B. Bilateral pulmonary crackles. C. Pink frothy sputum. D. Jugular venous distension. Choose your answer. The correct answer is D. Jugular venous distension. Right-sided heart failure causes blood to back up into the systemic venous circulation. This can cause JVD, peripheral edema, ascites, and weight gain. Remember, right, SAS, rest of body. Final recap. Let's put everything together. Left-sided heart failure means the left ventricle cannot pump effectively. Blood backs up toward the lungs. Think dyspnea, crackles, orthopnea, pulmonary edema. Remember, left, west, lungs. Right-sided heart failure means the right ventricle cannot pump effectively. Blood backs up into the systemic circulation. Think jugular venous distension, peripheral edema, ascites, rapid weight gain. Remember, right, rest of body. For nursing care, focus on respiratory assessment, daily weights, strict intake and output, edema assessment, lung sounds, medication response, electrolytes, renal function, and early recognition of worsening fluid overload. If you understand where the blood is backing up, you do not have to memorize heart failure as two random lists. That is the key. Subscribe to Nurse in Canada for more NCLEX nursing reviews.